It is a sound many of us know all too well. The morning creak from a knee as you get out of bed, the dull ache in your hips after sitting for too long, the stiffness in your fingers that makes simple tasks feel difficult. Joint pain has become an incredibly common part of modern life, and it is something I see in my clinic almost every single day. Many people simply accept it as an inevitable part of getting older, a tax we must pay for living longer lives. But I want you to know that this is not necessarily the case. You do not have to just put up with it. The numbers behind this are quite staggering. The most common cause of this widespread discomfort is osteoarthritis, a condition that affects the entire joint. As of today, nearly 600 million people across the globe are living with it. And with our lifestyles becoming more sedentary and our populations living longer, experts predict that this number could soar to 1 billion people by the year 2050. It's a global health challenge that touches families everywhere, affecting our ability to work, to play with our grandchildren, and to simply enjoy the freedom of movement. We cannot ignore this silent epidemic any longer. When faced with this persistent ache, what do most of us do? We reach for the nearest solution that promises quick relief. We might turn to over-the-counter painkillers, hoping a pill can silence the discomfort for a few hours. When the pain becomes more severe, a visit to the doctor might lead to stronger prescriptions or a referral to a surgeon. The idea of a joint replacement can seem like the ultimate fix, a way to get a new part and start over. These options feel concrete and decisive, but they often fail to address the root cause of the problem. The truth is, while pills and surgery certainly have their place for some people, they are too often seen as the first and only answer. We have been conditioned to look for an external fix, something a doctor can to us. But what if the most powerful, effective, and evidence-based solution was not in a bottle or on an operating table? What if the best treatment was something you could do for yourself, starting today? The science is becoming clearer every day. The most potent medicine for joint pain is already within you. It is your own body's ability to move. For decades, the standard advice for a sore joint was to rest it. If your knee hurt, you were told to stop walking on it. If your back ached, you were advised to lie down. This approach seems logical on the surface. If something hurts, you should stop doing the thing that makes it hurt. However, a growing mountain of scientific research is telling us a completely different story. In fact, for most cases of chronic joint pain, particularly from osteoarthritis, rest is one of the worst things you can do. The most effective treatment is not rest, but the right kind of movement. This might sound completely counterintuitive. How can moving a painful joint possibly make it better? The key is understanding what a joint truly needs to be healthy. Your cartilage, the smooth protective cushion at the end of your bones, does not have its own blood supply. It cannot get nutrients and oxygen delivered to it the way your muscles can. Instead, it relies on a process that works like a sponge. When you move and put gentle pressure on the joint, the cartilage compresses, squeezing out old, waste-filled fluid. When you release that pressure, it sucks in fresh, nutrient-rich fluid, which lubricates and nourishes it. So, when we avoid movement, we are essentially starving our joints. Without that gentle pumping action, the cartilage becomes brittle, thin, and unhealthy, which only makes the pain and stiffness worse over time. This is why inactivity can accelerate the progression of joint problems. Many people who think they are protecting their sore joints by keeping them still are, with the best of intentions, unknowingly contributing to their decline. It's a vicious cycle. Pain leads to inactivity, and inactivity leads to more pain. We need to find a way to break that cycle. The good news is that the solution is not only effective, but also incredibly empowering. Structured exercise programs designed specifically for people with osteoarthritis have shown remarkable results. Studies on programs like GLADR, Good Life with Osteoarthritis Denmark, have found that participants experience significant reductions in pain, improved physical function, and a better quality of life. These benefits are not just temporary, they can last for a year or more after completing the program. This proves that with the right guidance, you can take back control and actively heal your own body. Let's dive a little deeper into the magic of movement. When we talk about osteoarthritis, it is easy to focus only on the wearing down of cartilage. But we now know it is a whole joint disease. It affects the bone underneath the cartilage, the fluid within the joint, the ligaments that provide stability, and, crucially, the muscles that surround and support it. Exercise is the only therapy that positively influences every single one of these components at the same time. It is a holistic treatment that strengthens the entire system, making it more resilient and less prone to pain. One of the first things to weaken when a joint is in trouble is the surrounding muscle. This muscle weakness is not just a symptom of arthritis. It is a major risk factor for it getting worse. When your muscles are weak, they cannot properly absorb shock or control the movement of your joint. This places more stress directly onto the cartilage and bone, leading to further damage and pain. Gentle strength training helps rebuild those crucial support muscles. Stronger muscles act like a natural brace for your joints, providing stability and protection with every step you take. Beyond the mechanical benefits, exercise also has a powerful anti-inflammatory effect on your entire body. We know that chronic low-grade inflammation is a key driver of many modern diseases, including osteoarthritis. Regular physical activity helps to lower the inflammatory markers circulating in your bloodstream. It's like a daily dose of a natural, side-effect-free anti-inflammatory medicine. This can help to calm down an irritated joint and even has the potential to slow down the disease process itself, offering benefits that no pill can currently provide. This is about changing your body's internal chemistry for the better. So, what kind of movement are we talking about? You do not need to become a marathon runner or a bodybuilder. The best exercises are often the simplest. Gentle, low-impact activities like walking are fantastic. Swimming or water aerobics are even better, as the buoyancy of the water supports your body weight, taking all the pressure off your joints while you build strength. Simple stretching or practices like Tai Chi and yoga can improve flexibility, balance, and your mind-body connection. Even simple strengthening exercises you can do while sitting in a chair, like slowly extending your leg, can make a huge difference. If exercise is so effective, why is it not the first thing every doctor recommends? This is a critical question. The reality is that healthcare systems are often set up for quick fixes. It is far faster for a busy doctor to write a prescription for a painkiller than it is to have a long conversation about lifestyle changes, explain the science of movement, and create a personalized activity plan. Furthermore, many doctors receive very little training in nutrition and exercise. As a result, treatments that should be the first line of defense are often overlooked in favor of drugs and surgery referrals. This treatment gap is a serious problem. Research shows that fewer than half of people with osteoarthritis are ever referred to exercise therapy or physiotherapy, even though it is the most recommended treatment. Many are given treatments that are not backed by strong evidence or are sent to see a surgeon before exhausting all non-surgical options. This needs to change. We need to empower patients with the knowledge that movement is medicine. We also need to encourage doctors to prescribe it as their primary tool for managing chronic joint pain, with pills and surgery as the backup plan, not the default. The journey starts with a single step. If you are living with joint pain, I encourage you to see this not as a limitation, but as a signal from your body that it needs more movement. Start small. A 5-minute walk around the block is a victory. A few gentle stretches while you watch television in the evening is a perfect start. The goal is not perfection, it is consistency. Listen to your body. A little muscle soreness is normal, but sharp pain is a sign to ease off. The key is to find a type of movement you enjoy, because that is the movement you will stick with. This is about more than just reducing pain. It is about reclaiming your life. It is about having the energy to play with your grandchildren, the confidence to go for a walk in nature, and the freedom to do the things you love without being held back by your body. The most powerful tool for healing is not outside of you, it is within you. Your body has an incredible capacity to heal and adapt. By embracing movement, you are not just treating a symptom, you are investing in your long-term health and vitality. You can do this. Take that first step today.